What's going on, everybody? Logan Arliss here, Illinois Aviation Academy. Glad you guys could join us for another Webinar Wednesday event. It's going to be an exciting one, but first, before I start, I'd like to go over some announcements from the Academy. Congratulations to all the newly rated pilots this month. Great job, guys. Keep up the good work. And another announcement, the pilot shop at Illinois Aviation Academy just got in some new neck gaiters with a custom Illinois Aviation Academy Flying Tiger logo. So make sure you pick one up next time you're at the Academy or online on our website. Now the topic tonight's going to be FAA Medicals. So before we get into it, I'd like to just discuss the different types of medicals and their durations. So the FAA requires you to obtain a medical to act as PIC or as a required crew member during flight operations. There's 3 classes of medicals that you can obtain. If you are under 40 years old, a first-class medical will allow you to exercise the privileges of an airline transport pilot or an ATP for 12 months. If you do not renew that first-class medical, your privileges will then defer to a third class, which is good for student, recreational, private, or sport pilot for the remaining 48 calendar months. Similarly, the second-class medical, which is required for commercial operations, those privileges will be good for the first 12 calendar months of the certificate, where then the limitations will then defer to a third class for the remaining 48 calendar months. A little bit different if you're over 40. If you're over 40 years old, your medical certificate will be valid for 2 years, 24 calendar months. If you obtain a first class, you can exercise those ATP privileges for the first 6 months. Then they will defer to a second class commercial privileges for the next 6 months. And then at that point, if you don't renew a first or second class medical, your privileges then drop to a third class private, student, recreational, or sport pilot for the remaining 12 calendar months. Tonight's guest is going to be Aviation Medical Examiner, Dr. Khalil Karim. He is also a pilot here at the Academy, and we're going to be discussing medical processes. So let's go ahead and get him onto the call. And he is connecting right now. Bear with us. Hello, Dr. Karim.
Yes, hello.
How are you doing tonight, sir?
Good, how are you?
Very good. Just wanted to say thank you very much for joining us. We're excited and looking forward to getting to chat with you a little bit about the medical process.
Sure, thank you for inviting me.
Now, before we get into the medical topics, I'd like to just discuss, you are a pilot yourself and you have been flying a Piper Matrix. So if you could tell us a little bit about what drove you to this aircraft and what you like most about it, that'd be great.
Yeah. I first initially started out with the Saratoga a few years ago. And we had went to the Saratoga because we have 6 seats for a family of 6. And as kids grew up, and all teenagers and young adults now, there was less room in the back for them. So, and we also need to increase our useful load. So we ended up upgrading to the Malibu Matrix, which gives us more space, more useful load, and allows us to fly into the flight levels, routinely flying at 25,000, getting better true airspeed and getting to our trips faster.
Absolutely, yeah, that looks like a beautiful airplane. So what kind of speed does that do? It's got to be up in the 200s?
Yeah, at flight level 250, it's 200, 205 knots true airspeed.
Great, fast little machine. So let's get into some of the medical questions. So my first question I'd like to start with is, what are the differences when going for a first, second, or third class medical in terms of the physical evaluation? So is a first class a more in-depth physical than a third class, and to what degree do they differ?
Yeah, for anybody under 35, there isn't that much difference between getting first, second, or third class. I often encourage students who are planning on doing a career, making a career out of flying, to just go ahead and do the first class and make sure that there's no issues that prop up that could affect their planning for the future for spending money on training. But the biggest difference develops at 35 years old when you do need an EKG to have a first class. After 35, you don't need to do another EKG until you're about 40 years old, but at 40 years old. And at that point, you need to do them every year. And there are some standard differences between the first and second versus the third class. Mainly the vision. It's you have to be at 20/20 vision for having first or second class. That's vision 20/20 vision with glasses or without glasses. It doesn't make a difference. Contacts are fine too. And also and then for the third class, it's 20/40 vision. So you don't have to be at 20/20, but it's better to be at 20/20 for obvious reasons, spotting traffic and having the best sight available for even flying yourself with the third class medical. We do an extra test too for the first and second class for the eyes, just to check to make sure that the eyes will get together in alignment, that you're not having double vision. And most people don't have issues with that, and especially if you don't have double vision symptoms, you usually pass that test too. Otherwise, they're pretty much the same. There's no difference between them, especially if you're under 35.
Yeah, very interesting. That's a very good point that, if you want to make a career out of aviation, it makes sense to go for that first class and make sure that you qualify, before paying out, a lump sum of money to get all your flight training done, and to find that out down the road.
Mm-hmm.
My next question for you is there a minimum or a maximum age requirement for obtaining an FAA medical?
Yeah, that one I hadn't thought about before, but going back and checking, there's actually no age limits, no minimum age or maximum age. The guiding criteria is whether you can pass the qualifying criteria for each class of medical that you're doing. So whether you're young or old, as long as you're meeting the requirements of the first, second, or third class, there is no requirements for the medical side of it. It's obviously there's requirements for minimum ages for your pilot license, but not for the medical.
Very interesting. As long as you're healthy, you should be able to maintain that medical certificate. Now, only 0.1% of all airmen are actually denied their medical certificates. Now, what medical conditions would prohibit you from ever obtaining an FAA medical?
The FAA specifically has what they consider 15 disqualifying conditions in their in the FARs, and any one of those, if you look at them, I direct people to go look at the AME guide for that's available to me online on the FAA's website. But if you look at them, about half of them are, or maybe less than half, are cardiac conditions, like having had a heart attack or having pacemaker in or having a heart valve replaced and so on. And the other half, which kind of makes sense, is that it related to psychiatric or neurological conditions that you might have. So they specifically cite bipolar disorder, for example, if you're having problems with hallucinations like psychosis, and then epilepsy, which is more of a neurological condition where you have seizures. Obviously that's another one that will disqualify you from getting a medical. But with any of these conditions, they do have the special issuance process to the medical exams deferred when I see you, but everything is gets submitted to the FAA, and then they have their doctors review your medical records. And like I said, like you said, 0.1% of pilots are eventually ever denied. It's mostly due to having conditions that are not really well controlled with medications or unavoidable to be on medications that are disqualifying. So you do end up having a special issuance, like what you're bringing up to the screen now, the special issuance process that helps you, even though you'll get a letter stating that you're disqualified based off of their standards, they'll say, we'll issue you a special issuance if you meet criteria, whatever their specific condition they're looking at, to try to make sure that you're safe to fly.
Absolutely, yes. You led right into the next question. So what are some of the most common issuance of special issuance medicals issued for?
The common ones, especially for the older guys, is the heart issues that people have. For the younger guys, that may be more related to the psychiatric disorders. They do have initial process when you first go to apply for a special issuance, where your AME or myself cannot issue the medical, but once they've received records and done a review, they'll give you a special issuance letter to state that you are okay to get a medical as long as you follow the criteria outlined in the special issuance. Each airman's special issuance will be custom tailored to their condition and status of their condition. So it usually will explain step by step what needs to be tested for on a regular basis and what needs to be brought to the AME for when you renew your medicals. There's maybe 20, 30 conditions that will be allowed to have a special issuance, and more than half of those are renewable by just going to your AME and submitting your documents, as opposed to having to submit everything back to the FAA.
Very interesting. Now, my next question comes in the terms of what is a SOTA, and what conditions would require an applicant to get a SOTA prior to being granted an FAA medical, and what does this process look like?
Okay, yeah, the SOTA is actually fits into under the special issuance category, but it is SOTA stands for Statement of Demonstrated Ability, and it pertains more to the conditions that are more static. There's that aren't usually progressive. A lot of conditions under the special issuance, like I said, for heart disease, or if you have diabetes, or if you have any kind of psychiatric conditions, those symptoms can get better and worse and will change with treatment. SOTA would apply to more of a condition. For example, if you had an amputated limb, you have a condition, you're missing a limb, but it's not a progressive condition. It's pretty static, and you don't expect that condition to change over time. It potentially could change, but if you do have no changes in that condition, your SOTA that you're issued doesn't have an expiration. Special issuances usually have an expiration to get updates from your physician about your status since your last medical that was done. But SOTA doesn't have an expiration. You just present it to your AME at the time of your exam. In order to get the SOTA, there is a process similar to getting the special issuance, where you initially see the AME and you have your exam done and everything submitted to the FAA. And at that point, depending on your disability, they'll probably want to, in addition to looking at your records, probably do a flight with you to see how you've accommodated to flying. And then based off of that, they'll take a look and see if you have any restrictions as far as what kind of medical you can get. Pilots can get first, second, or third class with the SOTA, but depending on your condition and severity, you may not be able to qualify for first or second class, and only for the third class. So varies case by case, but SOTA is, like I said, for a static condition, and doesn't change. Usually shouldn't change over time. Of note, though, some conditions can change, and if you do have a change in your condition, even though you've got a SOTA, you need to report that to the FAA, and that gets reevaluated again once you renew for your medical.
Very interesting. So now I'd like to go into some specific conditions. The first one is, can a pilot fly commercially? So can they obtain a first or a second class medical if they are colorblind?
Yeah, absolutely. The colorblind, there's different degrees of colorblindness, and there are different requirements for getting cleared to fly as a first or second class versus a third class. If you're when you get tested for colorblindness, most AMEs will test for it in the office using a plate chart that shows you different numbers in kind of in different colors on a color plate, and you just need to read the numbers that are kind of hidden inside those plates. And most AMEs don't have the easiest test, which is called the Farnsworth lantern. With that test, it's not having to kind of figure out where the colors are in a chart. It's similar to what you see with the light gun test. You have a lantern that gives you the different colors, green, red, I think yellow, and you just are able to just recite what the colors are. So usually I recommend, if you don't pass my test, I'd recommend getting into an optometrist that does have a Farnsworth lantern. If you are able to pass one of that test, which is probably the easiest one, they actually have 14 or so of them on their list of approved colorblindness tests. If you pass that, you'd save yourself a lot of time with the FAA trying to get cleared for flying colorblind. If you're able to pass that, that would save you that time, and you would always probably do that colorblindness, the same test over when you go back to do your testing. But if you can't pass any of those tests, then the next step for the third class would be to do an on-ground test where you go to the FSDO's office. There's a pilot examiner that can take a look at your ability to read the aeronautical charts, recognize colors on the chart, and read the chart. And then they'll also do I believe on the ground, they'll do a signal test, color signal test from the tower. And if you can recognize those colors and read the aeronautical chart, usually they'll clear you. If you good backtracking here, before you actually go for that testing, you can get issued a medical, but it'll say for not for nighttime flying or flying by color light signals. But if you pass that ground test, you can get that lifted and you'd be able to fly using your third class. The first and second class, since you're flying commercially and responsible for the lives of others, you are required to do in addition to passing that ground portion of the test, you have to take a flight with examiner 2, and they would check your ability to recognize objects on the ground, recognize terrain, read your panel, and make sure that you're able to recognize things in a timely fashion. So if you do pass that test, then you are cleared to get a first or second class, and you'll get a letter of evidence to present to each of your future medicals to say that you don't need to take a color blindness test anymore, that you've passed these tests, and that you're clear to get your first or second class if you qualify otherwise.
Very great. Great information there. Mm-hmm. Now, the next condition I'd like to talk about, so I know there's been some recent advancements in this. Can a pilot fly commercially and obtain that first or second class medical if they have diabetes?
Yes, they initially had it approved for third class only, that you could fly yourself around, but not for hire. And they've come up with a protocol for airmen that are on insulin. This protocol requires you to have basically a monitor that you'd have attached somewhere to one of your arms, and it continuously monitors your blood sugar. And then most often it's used in conjunction with an insulin pump. And the combination of those will gather the data as far as how well your blood sugars are controlled. And if you're meeting those criteria, you submit everything to the FAA. If you're meeting the criteria, they'll approve you for first or second class. So there's a pathway to flying commercially, even with insulin-dependent diabetes.
That's great. Good news.
Mm-hmm.
How about if a pilot has been diagnosed or has previously, maybe as a youth, been diagnosed with ADD? Yeah,
if you have it, or if you've even been diagnosed with it in the past, the FAA does require us as an AME to defer the exam. They basically want to know your history, even if you're off medications now, or if you've had it in the past, to review. One of the FAA psychiatrists will take a look at the medical records, and if you've had it or if you're currently being treated for it, there's a pathway to. It's under the special issuance process where you can get approved for flying. It's a little bit more involved because they'll end up wanting you to do a neuropsychological exam where you need to see one of the specialized AMEs that are either psychiatrists or psychologists trained, and they'll do a battery of tests, and those tests actually need to be performed without medication. So on medication, I don't believe there is a way to fly commercially if you're taking medication for ADD, but if you are able to be off of it and you pass that type of testing, then you will get a special issuance, and then that'll be reevaluated each time you renew your medical. So yes, there's a pathway for flying commercially, even if you've had a history of ADD.
Great. Now, how does the FAA handle a DUI? Will that affect your ability to get a medical certificate?
Yeah, it does have an impact on getting your medical certificate. For as far as when you go see the AME, they break it down into either having a single event that happened more than 5 years ago versus something that's more recent that's been less than 5 years. In either of those situations, they'll want you to write a personal statement regarding your what happened exactly and what your alcohol use is currently and how you're handling it. If it's been more than 5 years, usually that statement alone, personal statement that you put on file with the FAA, you give to your medical examiner, and that gets submitted to the FAA. Once you have that submitted, if, like I said, for a situation where you just had one single event and that was more than 5 years ago, and the other requirement is that your blood alcohol content was under 0.15 in that scenario, me or any other airman can issue your medical if there's no signs of any problems with drinking or dependence. For situations where it's a single event that's more than 5 years ago, we do need to gather a little bit more information from that statement in addition to getting court records of what happened exactly. And if you don't have any current issue with it, all that gets submitted to the FAA and they'll allow you to be issued. Of note is if you are pulled over and refuse a breathalyzer, it's considered a positive test that as if you had been drinking and had it above 0.15. So I usually advise airmen to go ahead and take the breathalyzer because if you have a chance that it's below 0.15, you'll be detected on that test. If you don't do it, it's as if you tested positive above 0.15, and it makes the process a little bit more complicated. And then for pilots that do have an issue with drinking, substance abuse, there is a process to continue to fly. You'd have to be in recovery, but you have to submit records from your psychiatrist and from the examiner. There you have special examiners, like I said, psychiatric or psychologist trained that will meet with you and gather the required information to show to the FAA that you're recovered and that you don't have a current problem with drinking. So even with worst case scenario, there's still a pathway to continue to retain your job and continue to fly for the airlines.
Very good information. Now, we had a question come in from one of our viewers, and the question is, are you aware of or do you know how the FAA is handling pilots that have tested positive for COVID? Is that affecting the medical process in any way?
There's no specific guideline for COVID. Generally, it'll follow the general requirement of any pilot that's got an illness to ground themselves until they're recovered. There's currently nothing beyond that. If you're symptomatic, not feeling well, using I'm safe and I think it's 61.53 that requires you to ground yourself if you're ill until you're recovered. But they don't have any requirements as far as any specific repeat testing or making sure that you're negative before you start flying again. Of course, any airline or charter company will probably have their own internal guidelines as far as what they want to do to make sure you're okay for flying again, but nothing directly from the FAA.
Great. I'd like to get into a medical or a medication question. So how would one determine if a medication can be taken and still be safe to fly? Because we know that, some even over-the-counter medications are prohibited. So how would one make this determination, or is there somewhere that they can go to find a list of medication that is approved to fly on? And how would they go about doing that?
Yeah, actually, the FAA does have on the AME guides portion of the website, they do have a link that's called "Do Not Issue, Do Not Fly," and that basically lists medications that are not permitted at all you can't get your medical while you're on those medications. And then there's the do not fly list, which is probably more pertinent to people that just take medications for when they're sick. But backtracking a little bit, before, more importantly than trying to figure out if the medication is okay, if you go back to the reason you're taking the medication, if you find that you're having symptoms enough where you have to take medication, you have to question yourself whether you're okay to fly because of the condition, not necessarily because of the medication. So if you've got a cold or if you've got headaches severe enough where you need medication, you may just decide you won't fly for the reason being that you have a headache or that you've got a cold. But if you do take something and you feel better afterwards, then the question is, okay, how long do I wait before I can fly safely? Mm-hmm. And a good rule of thumb is if you look at the dosing on the medication they've taken, if, for example, something says you can take it every 6 hours to control like cold symptoms, the safest way to avoid having side effects on that medication is to multiply that number by 5. So in the case of something that's required every 6 hours, multiplying by 5 is 30 hours. You give yourself 30 hours for that medication to be metabolized out of your system before you're safe to fly again. And then, of course, you're also basing it off how you feel. If after 30 hours you're still feeling the side effects of the medication, then you basically drown yourself for longer than that. But medications that are specifically listed by the FAA are on that do not fly or do not issue do not fly list on the website. So guys can always go back and take a look at those things. And if you're not sure, you can always call your AME to verify.
That's great. Now, in 2017, the FAA rolled out something called Basic Med. Could you describe this for us and let us know who would qualify to fly under Basic Med?
Yeah, with Basic Med, I believe as a push from pilots organizations that wanted another option for pilots that aren't flying commercially and didn't want to go through the medical certification process. So Basic Med is actually completely outside the FAA's medical certification process. It's a process that basically Congress has set the requirements for it, and in the regulations, they require you to basically go through, they give you a checklist of things that you can bring to your personal doctor, your family doctor, internist to review. It's basically similar to what you're doing when you're going to see an AME, but you're taking it to your doctor, and the doctor will fill it out. And if you meet the requirements, if you pass the exam and everything looks good, history-wise and physical-wise, they'll sign off on it and say you're safe to fly, and that's good for 4 years. You need to renew that every 4 years. And then there's another portion of it where you have to go to kind of this online seminar that is required for basic training. They review some basic things regarding your health and when it's safe to fly, when it's not safe to fly. So that requirement for the online course is every 2 years. You have to renew that course. Now, once you've done those, done the exam and you've done your online course, you just keep those in your logbook. You don't have to carry them with you when you fly. You just need your driver's license, basically photo ID, or your driver's license to show that identify you. And then the other items, the online course certificate and the physical exam, you keep in your logbook somewhere, so you can always produce to the FAA for anytime they request it.
Great. Now, while operating under Basic Med, is there any limitations to the aircraft that can be flown or the operations that can be conducted?
Yes, they do require that the aircraft that you're flying is under 6,000 pounds, and that it doesn't carry more than 6 occupants. So that would be you plus 5 passengers. You're also restricted from flying above 18,000 feet or flying out of the U.S. Otherwise, as you can fly as an instrument-rated pilot with Basic Med within the United States, and as long as you're under 18,000 feet, you're fine with using Basic Med for those types of aircraft. Oh, actually, and the other thing you can't do is you can't fly for hire with Basic Med. I did see that it's instructors are able to fly under Basic Med, but for commercial operations, flying for hire, you're not allowed to use basic med for that.
Awesome. Well, great information. Thank you so much for taking the time out of your night to share your knowledge and expertise with us at the Academy. And for everybody back home, you can schedule an appointment with Dr. Karim. His primary office is in Melrose Park, but he does do first, second, or third class medicals here at the Academy. Call to schedule by calling the number listed there, or we can do it for you online through our scheduling program. So thank you, Doctor. We appreciate your time.
Sure. Thank you.
Have a nice night.
All right. You too.
All right, guys, that is it for tonight. Thank you guys for joining us, and be sure to tune in the 21st of October. We're going to have Kristen McGinnis on. Kristen is a member of the DuPage Airport's Air Traffic Control, and we're going to be discussing air traffic control, training, operations, and career path. You won't want to miss it. Thanks for joining us. Have a nice night.